So, a warm good evening, everyone. Welcome to the second day of the International E-Conclave. This is a wonderful Sunday once again, and we are all of us are here gathered to learn about yet another very interesting topic, very commonly used in India, on nicotine replacement therapy.
So, let's go in for the quiz, which is one of the very interesting part for today. And we are having quiz for the today. We had a very wonderful quiz last Monday also, and today also we are going to have the quiz. So over to you, Shruti, to please start the quiz and please introduce the quiz master. Thank you, Shruti.
So much. I think that was a terrific panel discussion on the second Sunday, and I think a lot of questions regarding the NRT. It was a very interesting case. A lot of things to learn. So now let us move on to the quiz for the evening, which we have been awaiting since a very long time. So tonight we have with us Dr. Yuvarajan. He is the head of department in Sri Manakula Vinayanagar Medical College and Hospital. He's developed this department at par with the current institute. This is the first department in Puducherry to have respiratory intensive care unit and also the advanced interventions like medical thoracoscopy and endobronchial ultrasound in Puducherry. He has recently also inaugurated exclusive IP unit in Puducherry. Currently, he's the joint secretary of the Association of Pulmonologists in Puducherry, and his areas of interest lies in interventional pulmonology, sleep disorders, interstitial lung diseases, connective tissue disorders affecting lung, and airways disorders. So I welcome sir. Please conduct and host the quiz for the evening.
Yeah. So before we start the quiz, I have a small request. Please, we will be telling about this quiz on the Facebook page. All the results and everything will be available on the Facebook page. So I'm just putting the Facebook page link here. And I request, please take a minute or 30 seconds. All those who have not joined our Facebook page, it will just take 30 seconds. Please join the Facebook page, and after joining, just mention here joined. Yeah, so that would be wonderful, so that every one of you are on our Facebook page, and we can interact with you, and we can have more and more discussions on that. So, yeah, Namita, thank you. Others, please, if you can.
Yeah, first of all, thank you for inviting me for this wonderful session on this evening. I thank ICanCaRe and the whole organizing team who put a lot of efforts for the noble cause. Like, it's very important that I think all people should start some activity on smoking cessation, because as we are discussing a lot of ill effects of smoking. So we have come to the end of session, and these are the instructions for the quiz of today. So you think everyone will be muted and chat box will be disabled. Link will be shared in chat box, and the participants need to open the given link. Fill in the email and name first so that your response can be recorded along with your name. Start answering the questions. Following once, you will be given a total of almost like 20 questions will be there. Most of the questions, almost all the questions are in MCQ form. You have to just select the best option of that MCQ question. Once you are done, submit your response, and the decision will be on ours. Like, most of the time, like we will see to that. And participants with the most correct answers in less time shall be the winner. In case of tie, a lucky draw shall be performed, and results will be declared on the page, as already mentioned. So you enter all the details, like your name, email, mobile, and institute from which you are working or you are studying. City and occupation or specialty of yours.
So I'm just going to share this is, yeah. Sir, I think we can start.
Yes, sir. The question number 1, sleep disturbances are commonly reported in which of the following NRTs? We have discussed today a lot of options of NRT. Among these options, the most preferable option which can lead to sleep disturbances. Option A, nicotine patch. Option B, nicotine gums. C, nicotine lozenges. And D, nicotine inhalers. So question 2, which of the following statement is not correct regarding nicotine gums? So the first nicotine replacement therapy that was made available to the consumers, that is nicotine gum. And the option B is acidic beverage, that is soda, beer, and coffee, enhances the buccal absorption of nicotine. Option C should be avoided in patients with TMJ disease. Option D may not achieve sustained plasma concentration as compared to the patches. Which of the following is not a correct statement regarding gums? This is on historical question. In 1948, nicotine was first used by Welles, who is a general practitioner, for the first time to help the people to quit smoking in the form of which form he used first, like for quitting smoking. Option A, nicotine gums. Option B, inhalation of nicotine. Options B, IV injection. Option D, subcutaneous injection. Question 4, state the just mark the correct statement, which is true. Option A, nicotine lozenges delivers 25% more nicotine than nicotine gums. Chew Park Chew technique is generally used for lozenges. Option C, nicotine gums delivers a continuous nicotine doses. Option D, nicotine gums cannot be used in diabetic patients. Which of the following is true? Question 5, which of the following is not a side effect of nicotine plucklets gum? Option A, mouth sores. Option B, hiccups. C, dyspepsia. D, weight gain. And question 6, which of the following NRTs is used to deliver doses of nicotine more rapidly? Option A, nicotine in the form of nasal spray. Option B, nicotine gums. Option C, nicotine lozenges. Option D, nicotine transdermal patches. Question 7, Save the Youth campaign. That is SAVE stands for option A, suspension, arrogance, violent end. Option B, suspect, other, volunteer end. Option C, sensitize, assist, volunteer, enforce. Option D, strike, act, volunteer end. Question 8, VBA is regarding smoking. VBA is very briny advice. Option B, very brief advice. Option C, very brief assistance. Option D, very briny adventure. Question number 9. Diseases of lung.
He's disconnected, so I will just continue. The question 10. NRT is contraindicated in all the following except acute MI, unstable angina, bronchial asthma, patients with suicidal tendency. Question 11. In an average, smoker absorbs how many milligrams of nicotine per cigarette? So what is the amount of nicotine per cigarette? Okay. Question 12. Which of the following is a manifestation of nicotine withdrawal? I repeat the question. Which of the following is a manifestation of nicotine withdrawal? Weight loss, tachycardia, excessive sleepiness, increased appetite. Question 13. Which of the following?
Sorry, there was some connectivity issue was there.
Yes, no issues. I've come up to question 13. Please continue from question 13.
Yes, sir. Yeah. Yeah, no problem. There are some issue was there, sir, with the connectivity.
No
Which of the following NRT is advisable to be withdrawn prior to the performance of MRI, any MRI scans? Option A, nicotine gums. Option B, NRT patches. Option C, NRT inhalers. Option D, NRT lozenges. Question number 14, the most validated scoring that we commonly use to assess nicotine dependence, which is very important. Sometimes it helps us to guide for selecting the pharmacotherapy. Option A, Nelson scoring. Option B, Fagerstrom scoring. Option C, Nicholas scoring. And option D, Fahrenheit scoring. Nicotine has half-life of dash hours. Option A, 8 hours. B, 4 hours. C, 2 hours. And D, 1 hour. Question number 16. Name the plant alkaloid that is a partial agonist for alpha-4 beta-2 nicotinic acetyl receptors and is used as an aid to smoking cessation. Option A, varenicline. Option B, cystine. Option C, alanine. Option D, paclitaxel. Question number 17. NRT replacement, NRT therapy can achieve good results, all except when the patient wants to self-quit. Option B, when given in combination. Option C, when given in supervision of a specialist. Option D, when combined with behavioral therapy. Question number 18. The most important requirement for successful quitting is option A, patient's willpower. Option B, motivation. Option C, commitment. Option D, low nicotine consumption to start with. Option E, all are true. Question number 19, very important one. The most important reason for failure to quit the NRT is option A, not seeking guidance by specialist. Option B, poor will. Poor willpower for the patient. Option C, difficult in managing the cravings and withdrawal associated with the NRT. Option D, get addicted to nicotine from the NRT. And one second, most important one, the only organization in India providing 360-degree of the care for the tobacco cessation is option A, IPS, Indian Psychiatric Society. Option B, Indian Care Society. Option C, ICanCaRe. Option D, WHO. Okay, would you want to, or would you like to practice tobacco intervention in your routine practice after this workshop? Yes, no, I want to start ICanCaRe Tobacco Wellness and Oral Screening Center, or I want to get trained in the tobacco intervention with the help of the ICanCaRe, what sir has discussed just before. Yes, that's it.
Thank you so much, Dr. Yuvraj. And any comments by the specialist today? Anything that you want to
Yes,
say,
sir.
Dr. Yuvraj, to all the... And just to inform
Yes,
you,
sir, it was...
already we have got 25 submissions are already there. And I have got the highest mark, 20 out of 20. because I said I was part of setting the question, but otherwise, so thank you so much, Dr. Yuvraj. And I think the quiz master is here. So you want to say something, the quiz master, and then, sir, Dr. Yuvraj, anything you want to?
Yes, sir. Yes, sir. This is one of the most wanted program. I think that all people should practice. Tobacco cessation, smoking cessation. I think all the specialists should get actively involved so that we can reduce the number of ill effects of smoking. And as we all know that the clinical practice utilizing all this NRT is far less in reality. That has to be addressed. And after this repeated sessions, like definitely, I think it will make a change. And first of all, personally, I want to thank, because I actually practice this smoking cessation in my clinical practice, but I just personally want to thank the ICanCaRe for taking the initiative. And thanks for inviting me for this quiz.
Thank you so much, Dr. Yuvraj. And I think we had a wonderful day today with a lot of presentations, lot of inputs, and a lot of discussions. lot of hot discussions as well, and certain controversies that could have been raised, but means it was timely taken care, so that we have more discussions on the 18th and 25th, when we can come out with some consensus how we can all be part to discuss, or part to help the patients who wish to quit tobacco. Understanding tobacco, that is what I specifically say. Tobacco is a disease, and it is a complex disease, and that is why it needs lot of intervention, lot of understanding. Just by telling to a patient, just a single behavioral therapy is not enough, or for that matter, just giving a pharmacotherapy is not enough. It is a complex disease, needs to be addressed with all the things, with a multimodal approach. And that is what we will be discussing on our next, on the 18th. And I look forward for everyone to be part of it. And I, amongst the participants who are here, I specifically want to thank one person who is really have been actively giving answers and doing a lot of putting in answers to all the queries that has been there. I specifically want to thank Dr. Aruna DS. She is here from, I think, from Mysore. Dr. Aruna, if you can unmute yourself and say.
Sir, I am from Bangalore, sir.
Bangalore. Yeah, so thank you so much, Dr. Aruna. You have been answering most of the questions, and I should not be telling this, but she has got 19 out of 20 in the quiz just now that I saw. But nice. Let's see what are the overall for the quiz. It will be all the 3 days. Everything will be added together, and then we will the winners will be declared. So we look forward for everyone who has participated today to participate the next time also with the good results, so that we can, every one of them can be, we can declare the results on 25th, when on the penultimate date of the of the E-Conclave. So thank you so much, and over to Dr. Reena and then to Dr. Nimesh to end today's session. Dr. Reena, the academic director. Yeah.
Thank you, Dr. Pawan. Good evening to all our dear chairpersons, panelists, quizmaster, the moderators who have made, and of course, all our participants who have made this session, as every one of our sessions, extremely wonderful. It's great learning, great discussions, and great, interactions. It is this that really makes it fantastic. And thank you, Dr. Yuvarajan, for conducting this quiz magnificently. Yes. And I think, Aruna, you're always a great friend, and I always find you here in our sessions, and thank you for being there. And I really don't know how to say thanks enough for all of you, because this particular disease that we all need to join hands for, form a consensus, because many of us are working in silos. Some of us believe very strongly in behavioral intervention, some of us in pharmacotherapy, and some of us believe in both. But we need to come to some kind of consensus. And again, a nice question raised today by Dr. K.R. Sarkar as to when do we consider it quit? So when can we consider that? And then Dr. Nimesh saying, is there an occasional slip? Is that not okay? So do we think he's going in for a relapse? Do we think that there are other modalities that we can use? So the multimodal way that, because it is one human being we are talking about who has different perspectives, a psychological, a social, as well as an addiction because of the nicotine. So I think the next week is going to be highly exciting, because that is where the real essence of tobacco cessation lies, along with pharmacotherapy and behavioral counseling. Thank you so very much. And Dr. Nimesh, we do not know how to thank you enough. And
very briefly, thanks so much, Vinaji. Very briefly, big thanks to you, Pawan, Shruti, everyone in the core team and today's participants. I am reminded suddenly of 4 stages of group work. In group work and social sciences and behavioral sciences, there are 4 stages of group work described. And it so happens we happen to have 4 sessions. The 4 stages of group work are forming, norming, storming, and performing. So if one might oversimplify it, last Sunday we came together, we formed the group. Today we set some norms. Next Sunday maybe we will storm. And then on the 25th, and more importantly after 25th, like you and Pawan and everybody wants desperately, After 20th, maybe we will perform. Bye. Thank you. God bless. Good night.
Before we leave, can I request everyone to please switch on the video so that we can take a quick picture for today. Yeah, thanks. Thanks. Dr. K.I. is there. Dr. Christina, if you can switch on the video. Sanjay, if anyone else is there. So I think Shruti or Rishabh, please, over to you to click the picture. Yeah, it has been collected.
Done, sir.
Yes, sir.
Collected.
Yeah. Thank you so much. And
bye. Good night. Thank you, Pawan. Great job.
Thank
Pawan,
you so much, sir.
God bless. God bless, sir.
Thank you so much. Have a lovely Sunday.
Have a lovely Sunday. Next week we're going to meet at the same time with another interesting topic on multimodal treatment for tobacco cessation. So stay tuned, stay connected, and we're going to discuss more about it. So have a great Sunday, everyone. Thank you. Have a great day. Bye-bye. Have a great Sunday. Thank you. Bye-bye.
Thank you.